Black perspectives haven't always been centered in the telling of America's story. Now, we're taking center stage. Introducing NPR's Black Stories, Black Truths, a collection of Black-led stories from NPR's podcasts. Search NPR Black Stories, Black Truths wherever you get your podcasts.
A Bloomington normal doctor who created an all-natural supplement to help those with migraines and other headache disorders is now bringing his product to international consumers. Dr. Benjamin Taimoorazy runs his own headache and pain management practice in Bloomington and another in California. The migraine prevention supplement he created, called MiGuard, launched in the U.S. a couple of years ago. He's now expanding to international markets and spent this week in Dubai at a trade show. In this Sound Health interview with WGLT's Ryan Denham, Taimoorazy explains the spark that led to MiGuard's invention.
A lot of patients already were taking prescription medications for migraines or other headache disorders. And they had side effects, or it didn't work, or they heard of the side effects. Some other family member, their sister or their brother, was using some prescription medications. And so they always asked, is there any alternative? Should I take this? Is there any other option? And we knew from prior studies by the American Headache Society and the American Academy of Neurology the importance of certain all-natural substances such as magnesium, vitamin B2, feverfew, butterbur. There is bunch of all-natural ingredients that are available to us. And these actually were extensively studied by these prestigious organizations. And American Headache Society and the American Academy of Neurology had provided efficacy designation for these substances.
So how does MiGuard work?
Migraine basically is a metabolic disorder of the brain. So what happens in people who are predisposed to migraine headaches, at the cellular level in their brain, there is a faulty metabolic pathway. And as they cannot produce enough energy in their brain cells, then the level of stress, basically oxidative stress in the brain, goes up. And that is the beginning. So when you use these supplementation with these all-natural ingredients, you supply the brain with those ingredients that your brain is really needing them to process the metabolic activities properly. And then you overcome the oxidative stress and the neuroinflammation.
Does a product like this go through any sort of government regulatory approval, like through FDA, anything like that?
So supplements in the United States, they are not required to be approved by FDA. However, and most of them actually are not even produced in an FDA-registered facility. So our product is produced in an FDA-registered facility, but because there is tremendous science behind the ingredients of MiGuard, as they have been studied for decades, all these ingredients for efficacy and safety. And then we took it to the next step, which would be producing it in an FDA-registered facility. And they have their own pharmacists and chemists that they analyze the formulation for compatibility, no interaction between the different ingredients in the formulation. And then we took it a step beyond that, and we have the product third-party tested, again, for compatibility, safety, and lack of any heavy metals or anything that is harmful.
What has been the biggest challenge for you in terms of kind of making this transition from doctor running a private practice to entrepreneur and actually creating a product and selling it?
That is absolutely the biggest hurdle for a person who is not business oriented. Running a practice, you may call it, it's kind of like a business, but absolutely this is a different world. And so the biggest hurdle was how to spread the word about the product. And of course, word of mouth always is the best thing, but that's such a slow process. Our patients have been using it. They have nothing but brag about it and 5-star reviews from our patients, but we had to start basically using social media marketing. So it needs a lot of funds, really. Financially, that's I guess the biggest issue, that you need to advertise on Google, on Instagram, and all these other platforms.
Well, Doctor, you've been on the market in the U.S. for a few years, and now you're expanding to international markets. And you're getting some help from Bradley University's Turner Center for Entrepreneurship, which does some international trade work. So what have they helped with?
When I learned about STEP program, the State Trade Expansion Program, most states, a lot of states, I don't know if all of them, they have this program, but I was fortunate enough to connect with Bradley University's team, the STEP program team, Mr. James Foley and Mr. Jim Ryan, extremely helpful and constructive in this whole process that we got involved. And basically what they do is they connect you. Most importantly is they have a branch of this system, or in this system there is something called matchmaking program. So they identify the prospective attendees into these expos and they match you with them. So you're not like a fish in the ocean because there's thousands of people there, but they select they identify some interested parties that are actually looking for a product like ours, for instance, and they contact them and they create a connection.
That's Dr. Benjamin Taimoorazy, creator of the MiGuard supplement for those with migraines and other headache disorders. He spoke with WGLT's Ryan Denham.
Support for WGLT health coverage comes from Carle Health. You can count on Carle as your partner in healthcare. Information at carle.org.